Hey, everybody. So I've never done this before, but I want to share with you what we're up to, what we're trying to do here in my medical practice. I have made a decision to reduce dramatically more than more than 50% off the cost formerly for the Ultimate Start program, $2,200 to get a reading on an MRI scan, not just a reading, but also what you have to do to get rid of this deadly fat inside your body, inside your abdomen, the deadly fat that's around your heart, and the deadly fat that is inside your muscles that nobody else is reading except for physicians working with me in my practice doing this. We for 2026, we want to dramatically increase the number of people that can afford to get these MRI scans, get these readings, and join this exciting new movement to really reverse chronic disease by finding out what is the most important thing you can do to improve your health. So the Ultimate Start program is now significantly more affordable at $990. This is the link that you can go to growingbetternotolder.com/ultimate start to move ahead and get your ultimate start, your ultimate beginning on your new life for 2026, and get this reading by one of my physicians. Who knows? Maybe it'll even be me. So I do as many of these as I possibly can. So it's a great program. Once you know about it, I'm also going to throw in this deal to make it even more enticing. 50% off when you do this. 50% off my Alpha Maker program. Alpha Maker is, in my opinion, the single best community that you can be a part of, where we review for the first half of every program, which is live. It's also recorded, so if you can't make it, you can see it. The most interesting and the most important new bits of science coming out to optimize your health. So first half is important critical science on how to optimize your body, what the latest science is showing is coming out. I do a program on that. And the second half is opportunity for you to ask me questions. So you'll have access to me. I'm in the program. You'll be in there, be able to ask questions. Everybody else will benefit from this program. So Alpha Maker is a super exciting, very worthwhile program for you to be a part of. So now you can get it for 50% off if you act doing this particular program. So very excited to be able to do this. Now, I know it sounds like it's some kind of a sales pitch, but honestly, I'm doing this because I'm tired of people holding off. They want to try other things first to see if they can get rid of this fat. Meanwhile, you're collecting disease inside your body. You're falling apart. The sooner you get to eliminating this deadly fat, the sooner you start improving, looking way better, performing way better, because you are better. You reverse disease, you're improving your health by getting rid of this deadly inflammatory fat inside your body. So really important that you take advantage of this, and we make it as affordable as possible for more people to get these scans and get these readings. So I've done this now for thousands of people, and it's a very sad thing when people hold off and they put this off for another day. You want to be able to do this. The sooner you do it, the sooner you get going on the benefits of eliminating this fat. So this was a barrier before, price for some people, but now we've removed that to make this more affordable. I have a lot more physicians working in my practice. We're now in all 50 states. We're a national practice, all 50 states. We have licensure in all 50 states, and I've got plenty of physicians now. We need to get this available to people as much as possible. So we're reducing the price to answer the ability to be able to take on more scans and do more reading. So what you'll get from this, actually from doing this program is you'll get MRI guidance on this scan. It will be read by a physician, and not just AI or some other program or something. The physicians and I, and in our practice, are the only ones in the world doing this. We have 2 radiologists working with. They're the very first radiologists in the world to be reading this deadly fat with every scan they do. So I'm very proud of the program and the team that I put together, this capability. So time to spread this out and get it to more people. You'll get this reported to you, a video report. You'll see this deadly fat inside of you. You won't just get some physician report. If you notice, like, you get an MRI or an X-ray or a CT scan, it's just a report, your doctor. You need to see this. We're going to highlight it for you. We put this program on. We have studied the very best techniques, how to get the best results. And you're the most important person in the world that needs to see this. So yes, a physician has to read it, has to interpret it, but you need to understand it. And you will, if you do the Ultimate Start, you'll understand just how bad you are. As the MRI ends the lie, you're not as healthy as you think. So not only will you get that reading, but you'll get all my 50 strategies for reversing this disease and eliminating this inflammatory fat from around your heart. Excuse me, this inflammatory fat within your abdomen, and starting to accumulate inside your muscles, which leads to sarcopenia and loss of function. So you need to find out about this now, 2025, right at the end of 2025 and 2026. And you'll also get my 10 core principles of biological optimization. Not only strategies, but principles. To get the insights, you need to understand and apply those strategies more effectively. I've developed these principles, and we're giving it to you in the Ultimate Start as well. And then you also will get 2 months of chat coaching, being able to be coached through this process. We don't want to just do a reading. We want to get you better. We want this to be eliminated for your body. So we're doing everything we can. A lot of other services just read MRIs, just read X-rays and things like that. But I don't want to be like other services doing that. It's like reading cancer and not telling people what to do. And the other problem is, where are you going to get this level of expertise to eliminate this fat? Lots of people have ideas about eliminating visceral fat and fat around the heart and the muscle. And for the most part, they're greatly mistaken. So we possessed this expertise after doing it for 13 years. I literally have the most experience in the world as a physician reading and eliminating this visceral fat. So come to my practice, use our service to help you get rid of this and get the benefits of this Alpha Maker bonus that you get 50% off the Alpha Maker subscription if you take advantage of this deal. And again, that Alpha Maker is twice a week live programs that you can participate in, Tuesday nights, Saturday mornings. So you should be able to make those. They're all recorded if you can't. And there are over 90 fantastic programs, videos in there that you'll have this awesome library to be able to figure out what you got to do, the latest insights about biological optimization that we put together. And so it's a wonderful resource to take advantage of. All right, let's talk a little bit about how some people may come up with excuses. They might be a little bit skeptical about what we're doing. I want to be able to assure you that why you want to go ahead and do this. So if your MRI shows 0 visceral fat, I'll refund your money. But I need to, in all fairness, tell you, I've never seen it. I've never seen it happen. You'll have visceral fat, but if you feel that strongly about it, you doubt that you have any visceral fat, come forward and I'll refund your money if you have 0 visceral fat inside of you. But after doing this for 13 years, thousands of people, visceral fat is the disease you cannot see, and I'll show you some pictures of it, and including in really fit people where it's been elevated. So uh, also, if you follow, you do the ultimate start and you follow the strategies and do it for 90 days and you don't feel dramatically better, my team will work with you until you do. Okay. Cause nothing, I'm a health optimizing physician. I could choose any target in the human body. I don't choose VO2 max. There are a lot of people out there with fantastic VO2 max and they're falling apart. I choose what really matters, what improves people the most, and it's getting rid of this dangerous inflammatory fat inside your abdomen, around your heart, and inside your muscles. So we'll work with you and make sure that you get rid of it and feel significantly better for doing so when you do. Really, really powerful experience getting rid of this. All the testimonies that we're getting, people completely optimizing their health, their appearance, their lives, getting rid of this deadly fat. So, who this program is not for? People that want a quick fix. Okay, if you're somebody who wants a pill, if you that Ozempic, something fast appeals to you, we're not. This is not going to be a good option for you. But it also is not a good option for somebody who won't do an MRI. You need to see the disease inside you because it's the man or woman who sees they have a problem that's willing to do something about it. We've tested this for years, given solutions to soldiers and first responders, and they wouldn't get better. Or they wouldn't do the strategies because they didn't think they had this disease inside until we started scanning them. So the study from the National Science Foundation taught us that it's a very important principle. So you got to see that disease inside of you before you really do it. Otherwise, you're just fooling around, just playing around. You're not going to get the results that you'll get when you get that scan and see what's going on. So really important. And also the third category of people that this isn't a good option for people who just want to keep eating garbage, keep destroying their most important physical asset by eating, processed foods and garbagey food into your body. This isn't a good option. I wouldn't even want you to even attempt to do this. So if that is your strategy, you think, oh, well, I'll do this and cheat and be able to eat bad food and get rid of my visceral fat. That is not a good option for you. Secondly, who this really works for are really busy professionals, people that are just busy people that want to become the best biological versions of themselves possible. People who want to be better influencers, who want to be able to influence more people. Maybe you're a sales executive. Maybe you're in charge of a sales operation. Maybe you're a consultant. Maybe you're a public figure. Maybe you're a C-level executive with a large corporation and you lead a team and you want to be a better influencer. Or maybe you're in the social media space and you just want to look better and perform better and influence more. Or maybe you're like many of my clients recently, a senior politician who wants to be more electable, who wants to represent their people better by becoming better influencers. So I work with U.S. senators, senior members of Congress, governors, ambassadors, cabinet secretaries, just public figures who have found out about this deadly fat and want to get rid of it. Their experienced advantage, and everybody should. Everybody really should be aware of this. So what I'm trying to do with this program. Make it more affordable and a lot more available. So remember, you get half off Alpha Maker, my other program, to support you and be a part of my community online when you do this Ultimate Start program. So it's a great thing. And you're ready to take action. You go to that link and click on it. And then the other thing to be aware of is I have a couple program options for people if you don't want to do the Ultimate Start. Let's just say you really can't even afford to get an MRI, do this program. Then you can just do Alpha Maker and be a part of my program until you're able to afford the Ultimate Start. And if you go to Alpha Maker, you just go to growingbetternotolder.com/Alpha Maker. But if you're can qualify for my Patriot pricing, I'm the only one that does it. Sometimes I think nobody else cares in America. I mean, but I do. I care about patriots. Okay, I'm a patriot, and so if you have ever served in the military, I'm a retired Army colonel. If you've ever been in the military, whether you retired or not, you served in the military. You have served in government. You're presently in government, or are serving in government, or have served in government, or you are a first responder, or have ever been a first responder. And recently, I made a decision to extend that to all those people for 90% off. 90% off, because I was there. I did all of those jobs. That was me. And listen, I know from experience in America, if you haven't figured this out, people that do those jobs don't do it for money. Yes, they get paid, but they do it for something more important, for service. And so I'm doing my part to offer 90% off for people like that. And then recently, I've extended that to nurses, because nurses are so critical. They're overworked and underpaid. I'm going to tell you that as my perspective and experience as a physician who worked, 2 decades in hospital systems, and they truly are. They make sacrifices like you can't imagine, and they're not compensated as well as physicians, but they work so incredibly hard. And so I want to make this more affordable to them. Sorry, docs, you guys should be able to afford this, but for current nurses and former nurses, I want to extend my Patriot program to you. So you can just go to growingbetternotolder.com/Alpha Maker Patriot. Nice and simple. So you can do that and have a benefit. All right, let me show you how people think that they don't have any visceral fat inside, but this MRI scan shows this elevated amount of visceral fat, this deadly inflammatory visceral fat surrounding colon, small intestine, pancreas, the stomach, all throughout the abdomen, and goes down into your pelvis, surrounds your rectum, wearing out your rectum. So you start leaking stool and losing control, fecal incontinence, and around your bladder. So you start leaking urine. So this elevated amount of visceral fat is contained within this guy here. Look how shredded he is. You would never imagine that he's got that elevated amount of visceral fat inside just by looking on the outside. You can't tell this deadly fat from the outside. You need to get scanned. So I wanted to point that out. And then, I want to also point out how much this can really change over a period of time. This is one of my radiology colleagues. This is Dr. Anna Rosa. God bless Anna Rosa. What a fantastic human being. She was chief of radiology at my hospital system in the VA when we worked together. And I went to her as a knucklehead ER trained physician and started talking to her about visceral fat. And God bless this lady. She was a woman of faith, and she listened to me, and she even got scanned. And look at her recent scans. This was from May, and then recent since then, and then just this past Friday. So in just the past about 9 months, look how much she has reduced her visceral fat inside of her. I mean, that is really exciting how much she has progressed. Now, what you ought to be looking at is like this big tummy that she had, this big bulging tummy. Now she's getting this nice oval shaped abdomen. And she's not stopped. I just got off the phone with her right before this video, and she's incredibly motivated. Probably, the most motivated radiologist out there. And she's really doing her part. Every single reading, scans that coming from her, reading this visceral fat, this deadly fat, and the fat within her muscles that you could see previously. You see how they're diminished now. That fat there, a lot less. And do you see how thin her muscles were originally back in May? Look how thick they are. So Dr. Rosa does sprinting. Okay, she's working out in her 50s, and she's putting on muscle. Look how thick that is compared to before. So you can too. That's why you need to do MRIs. You need to track it, not just for the disease, but to track it for the improvement in your health. So wanted to point that out. And also her heart fat. So Dr. Rosa's scan, when she originally got scanned in May 2025, this thick area of fat surrounding her heart. And look how dramatically thin she's gotten at. Isn't that exciting how much she's reduced that heart fat in that short period of time? So very, very exciting how much she's improved. That deadly fat that surrounds her heart and surrounding your heart, covering your coronary arteries, where you end up having the heart attack. This inflammatory fat is around it, and your cardiologist doesn't even know about it. Isn't it incredible? Incredible. But select people are finding out about this. You follow me, getting these scans. You want to be included in that. All right. So I'm excited for an opportunity again to offer you this great half price off. It's better than half price off now for $990. Go to growingbetternotolder.com, Ultimate Start. You'll be able to get this Ultimate Start, the reading, the program, for just $990. So it's more than half off. And you also get 50% off of my Alpha Maker program. All right. Well, I hope you appreciate the hard work that we're doing and building to bringing on these extra positions and getting them all insured. There's a lot of money involved that we have to do to put this all together. But we're doing this for America. We're doing this for you. We're doing this for our species. We want this to spread around the globe. All right. Well, as always, I look forward to your comments about this. I'd love your questions online. And I'd love for you to give it a like, to help this get moved along, to get in front of other people. So like the video, subscribe to my channel if somebody's forwarded this to you, so you have the benefits of subscribing and getting this kind of content delivered to you right away when it comes out. And consider sharing this with other people so they can find out about this. If you have a loved one, a family member, somebody that has had a heart attack, somebody who's had a stroke, somebody suffering from chronic disease, find out what their visceral fat is, help them do that, and work on eliminating and watch what happens. Because in those 6,000 people that we studied from the National Science Foundation, we saw every chronic disease that they were diagnosed with previously either significantly improve or go completely away when they got rid of this inflammatory fat. Wouldn't you like to try that out if you're struggling with chronic disease? All right. Well, thank you very much for hanging with me throughout this video. And I look forward to bringing more health optimizing content to you in 2026.